Miami-Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. And we have another action-packed program tonight, taking you on an adventure of health. We're going to start out in the first segment with Dr. Alan Patterson. He's an OB-GYN located in Coral Springs and right here in Boca Raton, 2 offices. And then at 6:30 p.m., we have Dr. Arthur Iglesias joining us. He's a radiation oncologist from North Shore Medical Center in Miami. He's going to talk about the EDGE radiosurgery system. So we have an action-packed program, like I said, so I'm going to get right to it. I want to welcome back to the show for the 4th time. You're in the lead, Dr. Alan Patterson.
That's great. Thank you very much. Appreciate being here. Always love to be here.
And you're great. You're always gung-ho about doing my show, and very passionate and very energetic, and I don't think you've ever told me no when I've asked you to come on the show in the 2 years of doing this. So, I mean, the reason why this show is successful is doctors like you, so I'm so happy to have you on. And we have so much to talk about. Like I said, you have 2 offices right here in South Florida, Coral Springs and Boca Raton, but you just cover so many areas of interest that I don't even think we have enough time to get through in 30 minutes. So I want to get right into it, though. Why is it important to be board certified when you're looking for a doctor to, watch over a patient during pregnancy, but also deliver the baby? I mean, we hear it all the time, board certified, but not all physicians are board certified, correct? You can practice without being board certified.
You can practice without being board certified, but in South Florida, most of the hospitals now require you to either be board certified or board eligible. Board eligible means you just got done with your residency. You're in the process of becoming board certified. So a lot of the hospitals in South Florida won't let you practice until you're board certified, which means after you've had your proper training, which is med school, and then for obstetrics and gynecology, it's 1 year internship and 3 years of residency, 4 more years. There's written boards, and then the hardest test you'll ever take is an oral board. Once you pass your oral boards, then you're board certified. Nowadays, every so often, you have to do recertification. When I try to keep up with everything. I was the last, I'm old enough, unfortunately, I hate to say it, but I was the last year that you didn't have to get recertified. But now, ever since the year after me, every so many years, the doctor has to take a test and become recertified, which is a good idea because that way you know your doctor is kept up on the latest things. So there's 2 aspects of it, being board certified and also learning new techniques after you've trained, because new techniques come out all the time that I wasn't trained in my residency. You go back and learn a new technique that's maybe better than what I was trained with, so you can practice that for your patients and give them better care.
Wow, it sounds like the hospitals really keep up on that, and that's great because delivering a baby can be a complex process, as I've seen for myself, and as you've seen, what we were saying, 5,748 times, or we're close to that.
Somewhere around there. I lost the exact number somewhere, but the thing I can say is that in the United States, I mean, you want to deliver at a hospital or a birthing center. Mm-hmm. You don't want to deliver at home. That is one of the dumbest things anybody can do, because while we all hope we're going to be okay and want to be okay, you can be totally normal and have a totally normal pregnancy, have no health problems, and you could have a problem with in labor, at delivery, or postpartum. Whereas if you're going to somebody well-trained like me who has experience and at a good facility like West Boca Medical Center or Boca Regional Hospital where I deliver, they have the facility, the people, and the expertise to take care of a complication. Whereas if you delivered at home, it would be a disaster, and I could talk for weeks about disasters I've seen when I used to have to take ER call about people that tried to deliver at home. And the one thing they always said was when they came in, I never thought that would happen to me. Mm-hmm. So hopefully I'm always prepared and want the best, but I'm prepared to deal with the worst. So in the United States, please don't deliver at home. Deliver at a hospital or a birthing center. It's the best thing you can do for yourself and your baby.
And a good point about the hospital. Obviously, there's a ton of other medical specialties there. If they have to see, I don't know if this happens, cardiologist or anything like that.
Exactly.
Right?
Sometimes a pregnant lady can have a non-pregnant issue or an issue that affects her pregnancy and labor and delivery or postpartum. So if you need a consult, if you're at a good hospital with good other specialists, then you can do that. Things happen at the hospital, complications all the time, but if they're properly taken care of, almost always you have a good outcome, whereas if you delivered at home, it'd be a disaster.
Mm-hmm. That's a great point and something that everyone should take into account when they're, planning. I know that a lot of planning goes in when the pregnancy starts, and obviously women plan with their family, their spouse, and also their primary care doctor and their OB-GYN. So that's very important. And I just have to point out before I forget, you delivered a baby today, so congratulations. I think that's great. Didn't know if we were going to have you on the show, but you were pretty confident that you were going to be here. So
everything turned out well. I don't want to give any details, obviously for privacy reasons, but everything turned out great. So I'm glad to be here tonight.
Okay, well, let's talk a little bit. We talked a little bit about obstetrics.
Obstetrics.
There. That one always gets
that
me.
Easy word to say.
But now you also treat gynecology as well. Issues, and one of them that I was looking on your website, and I'm going to give out here in a minute, is premenopause. Now, I've always talked with doctors on this show about menopause. I know it ties into the heart a lot. I've had a lot of cardiologists talk with us on the air about menopause and other aspects, but there's a premenopause as well. I didn't know that even existed, but you actually treat this condition?
Yes. Well, I mean, when women get older, the definition of menopause is when the ovaries stop working, you don't have periods for a year, assuming you still have a uterus. But you can have symptoms before you stop having periods, such as hot flashes, irritability, night sweats, vaginal dryness. And if people are getting symptoms, women, there's no reason to suffer because there's many good treatments that we can prescribe, both herbal, which I offer herbal care, and prescription care. I mean, sometimes people want to try herbal products, and I have a couple great websites or apps that I use. One is Green's First Female, and they have great products for herbal products. If they don't like that, then they can try prescription products also.
Well, I didn't know that. So herbal products as well as prescription products. And now, menopause itself, how do you treat menopause?
Yeah, menopause, it just depends on the symptoms of the person. A lot of people have hot flashes when they go through menopause. So once again, you can use herbal products for like Green's First Female or Shift MD. That's another great app that they can just ship the product to the patient. Or some people may need prescription products, such as hormones or non-hormonal products. Another area that's more talked about now is vaginal dryness, because vaginal dryness, the vagina and the urethra and the lower third of the bladder are dependent on estrogen. So as people age, they can get dryness where they have painful intercourse or itching or burning or think they have a bladder infection. And it's just really from the tissue not having estrogen. So there's vaginal preparations such as Premarin, Estrace. There's a new DHA product that you can use in the vagina to treat that so people don't have to suffer, because you want to be able to live your life and enjoy your life, and you want those tissues to be like they were in your 30s and 40s, and there's no reason not to take products if you need them as opposed to suffering.
We talk a lot about this on the show is quality of life, and that's something that, I think as doctors, it's a great thing you help people out with their quality of life. You're really concerned about, their quality of life, to put it.
Well, people are living longer, and, they want to enjoy themselves when they're older. I mean, I'm older now. I want to be able to do as many things as I can. And when women are older, they have relationships. They have a life to live. So there's no reason for them to suffer with those issues if they can get on the proper therapy, which is individualized to the patient. What might work for one patient won't work for another patient, so you have to sit down and work with the patient. Some people want herbal products. Some people want to go straight to prescription. Some people use both. So it just depends on the person, but you want to help them with their symptoms so it doesn't interfere with their daily activities or their relationship.
Definitely. And I'm glad that you offer both herbal and prescription, because that gives person a choice. And key point there, relationships. Healthy relationships in life, that's been proven to help people live longer and to actually kill stress as well. So I want to give out your info a few times while you're here. Dr. Alan Patterson, he's an OB-GYN and infertility, which we're going to talk a little bit about, located in Coral Springs and Boca Raton. Great website. I'm actually on it right now, OB-GYNPatterson.com. You'll get all of the areas of interest Dr. Patterson covers on the site, as well as his office locations in Boca Raton and Coral Springs. And like you said, on staff at both Boca Regional Hospital right here, around the corner from the studio here, and West Boca Medical Center, which I have a unique tie-in to. So thank you for mentioning those. Let's turn a little bit. What types of birth control are available today, and what do you recommend as an OB-GYN?
Well, there's many different types of birth control available, and it just depends on the person. There's so many different types. There's birth control pills, and now the nice thing nowadays, there's a much lower dose pill called low estrin that only has 10 micrograms of estrogen. So people have a low-dose option. There's Depo-Provera shots that's been around forever. There's IUDs. There's vaginal ring. There's patches, but people don't use the patches much anymore because they saw the hormone content is higher. There's also a new female condom, the FC2 female condom. So the female uses the condom, which has the advantage of it's covered by prescription, and the woman puts it in. It's latex-free, lubricated, prevents diseases and pregnancy, and she doesn't have to worry about the man who may or may not put the condom in on time, because with the female condom, you can put it in 1 to 2 hours before intercourse. And then for permanent sterilization, you can have your tubes tied if you have a C-section, at time of C-section, or a laparoscopic tubal. But a newer method, it's not new now, is the E-Sure sterilization that can be done in the office. If you're not allergic to copper or metal, it's a great option, because you go in through the cervix and the uterus with the hysteroscope and put a little coil in the tube, so there's no cutting, no interfering with the ovary. We do it in the office. The patient's awake. It's much more convenient and safer and cheaper for the patient than going in the hospital. It's a great procedure if somebody definitely doesn't want children anymore. That's a permanent one. So there's so many options for birth control. You just have to sit down with your patient and discuss, all the different options and see which one she wants, because what's good for one woman obviously may not be good for someone else, and sometimes you may have to try more than one option. But, even if somebody's single and they're using birth control pills, they should still use some kind of barrier contraception, such as male condoms or the new FC2 female condom. And, if you get in a relationship, I strongly recommend that you have your partner tested for STDs, blood work, and whatever before you have relations, because somebody can be carrying something asymptomatic and it's not worth it if you don't know about it and you catch something. It's a disaster. So nowadays, more people are open to that. The male and the female get tested, so everybody's fine, instead of end up with a bad problem that could affect the rest of your life.
Dr. Patterson, hold that thought. We're going to take a quick break, and on the other side, talk a little bit about HPV and preventative medicine on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
That's right. We're here with Dr. Alan Patterson. You just heard the call-in number. He's here till 6:30, so if you have a quick question, please call into 1-888-565-1470 or ask us a question on All County Healthcare INC's Facebook page, All County Healthcare Incorporated. You can put that right in this Facebook search bar. And if the question's appropriate, I'll try to get it in front of Dr. Patterson. I see everyone sharing the Facebook Live post, so thank you. Sometimes we get more watchers on social media than on the radio, and I think that's great, but you never really know. But if you do have a question, please ask it. We were talking about Escher sterilization. I think I got that right. That's the one
Correct.
You do in office. And I was asking you during the commercial break, is that painful for the woman? I mean, it's done in the office, so I thought maybe it's nice.
For the average person that we do it on, we give them a little, everybody does a little different. Some people may bring anesthesia in their office to give them something to go to sleep with. But I was trained, and the doctors in my organization were trained that we do it. The patient is awake. We give them a few pain pills, a shot of Toradol, numb up your cervix, and 99% of the people do well. There's obviously some people that are not candidates to do in the office. They may have a harder case or something like that. Those you would do in the hospital. But 95% of the people that we work with, you can do Escher tubal sterilization in the office, hysteroscopy and biopsy, suction DNC, MyoSure, endometrial ablation. Those are all procedures to treat various and diagnose various things that you can do in the office, that you don't have to take the patient to the hospital, and it's better for the patient to do it in the office because it's more convenient. They'd rather come to my office. They don't have to go to sleep. And the insurance company, they have much better benefits, and they pay much less when they do it in my office than when it's done in the hospital, because the hospital is a doctor charge, a hospital charge, an anesthesia charge, So it's more expensive for the insurance company, more expensive for the patient, and also we get reimbursed better to do it in the office because we assume all the expenses. So they just give us one global fee, so it's a win for everybody.
Nice.
So that's the tendency in GYN, to try to do safe things in the office instead of taking the patient to the hospital to do them. There's certain things you have to do in the hospital, like hysterectomies, C-sections, deliveries, but for things that are safe to do in the office, and if you have the proper equipment and the training, it's much better for the patient.
That's fantastic. And we're here with Dr. Alan Patterson. We've already talked about board certification, premenopause, menopause, birth control. I want to ask you about, because it's always in the news, HPV virus, and I may be saying around human papilloma virus. Did I get it right?
Very good.
Practice it. I did my research. But that's something that I believe adolescents need to be thinking about that, right?
Well,
parents.
Nowadays, you can get the vaccine, the HPV vaccine, and they're coming out with new vaccines. The present vaccines protect against the HPV virus that causes 80% of the problems, and newer vaccines are going to give better protection because HPV is sexually transmitted, and HPV is often asymptomatic in the male, so they don't even know they have it. But the HPV virus has been proven that causes abnormal pap smears, i.e. cervical precancer, or if it's not diagnosed in time, that should never happen now, cervical cancer. But by taking the vaccine, you can prevent getting most of the strains of the HPV virus. So nowadays, that's a good thing for young women to get, and they can be vaccinated by their pediatrician, and they're coming out even new and better vaccines. But it's important to get your pap smear because that is preventative, because hopefully you have a normal pap smear, but if you have an abnormal one, you want to catch it early before it turns into something. And also when women are coming for their yearly exam, we're just not doing their pap smear, we're doing the breast exam, teaching them how to do breast exams, doing a whole pelvic exam, checking the vulva, the vagina, the pelvic organs, the uterus, because sometimes somebody can come in and they don't think they have a problem, and you discover something where as if they hadn't come in, it could have turned into something bad. So I'm always big into prevention. We'd rather prevent things than have to treat things. And nowadays, for somebody to get cervical cancer is just a tragedy, because if you don't get the vaccine, you can at least come in for your pap smears, and now you don't have to come in every year for the pap smear. If they're normal, you can space them out. But for somebody to not be sexually active and not have a pap smear for 10 or 15 years, it's just a tragedy, because every once in a while I see somebody like that, and it's not a good outcome.
Yeah, and you do it right there in the office as well. And you mentioned the breast exam. That's for breast cancer, and that's done at the yearly examination as well. Okay.
And it's important for women to practice self-breast examination. They should check their breasts every month, or at least every 2 months after their period, do a self-breast examination. If they ever feel something, then they need to come in for an exam, and most of the time it's nothing bad, but a lot of the early breast cancers are picked up by the patient themselves. And as you know, with breast cancer, we don't want anybody to get it, but the sooner it's diagnosed, the easier it's treated.
And you mentioned, too, preventative medicine, and I wanted to ask you, what is a pap smear? Why is it preventative medicine?
Right, a pap smear is where you take cells from the cervix and they analyze the cells, because you want the pap smear to be normal, but if it's early abnormal, then it's easy to treat, so you prevent it. You never want it to develop into cervical cancer. We're trying to prevent cervical cancer. So if the pap smear is not normal, we usually catch it before it's cancer, and then you can take care of it so it won't turn into cancer.
I see. Okay, so yeah, that's why it's preventative medicine. That's great. Again, we're here with Dr. Alan Patterson, OB-GYN and infertility, which I want to ask you about in a second. Located in Coral Springs, 7451 Wiles Road, Suite 205, Coral Springs, and Boca Raton, 660 Glades Road, Suite 340, here in Boca Raton as well. And then the website is OB-GYNPatterson.com. So definitely take the time to look at Dr. Patterson's website. There's the areas of interest there. They're under services, breast cancer awareness, insurance. That's nice. So patients or prospective patients can click and find out what insurances you take and how it works.
Exactly.
There's testimonials there. contact bar as well. You can book online, which is fantastic as well. And you may even see this radio show video pop up there as well. It's on there. You were telling me.
I posted the last three, so I'll definitely post this one once you send it to me.
Thank you. I
appreciate that.
I appreciate having you on the show. And like I told you before, you have a great website, so everyone go check it out. It's easily navigable, and I always mention that with Doctors On because I think that is great, because a lot of decisions are being made online, and you have a huge, almost 5-star rating, so kudos on that as well. 26 reviews on the site.
Thank you.
That's great to see.
I have a good company that does that, because I knew that I'm not an expert on the internet, so I needed help, and I'm very happy with the company that helps me do that. And more people, now everybody goes online. So you want to have a presence online, and you want people to be able to get information, book the appointment, whatever they need. The more you can do online, the better.
Fantastic. And you even have pictures of your website, or not your website, your office on there.
Well, just so people can see it.
It's very nicely decorated.
Thank you.
Kind of looks like king and queen throne there.
Thanks to my wife and her mom.
Wow.
They supplied all that. They have very good taste.
Almost looks like Baroque era a little bit.
It's a lot of antique, because that's their business. They sell antiques worldwide on the internet, so they supplied the furniture and rugs for my offices. They have very good taste, and it's very tastefully done. It's not your typical office. It's a little different decoration. It's more European style, which that's what we're into, so we like that.
That's great. It really is. And so I can just give a shout out to my mom. See, the humanities degree did pay off. I got it right. I looked at it and I described that it was the Baroque era.
Excellent.
So she's going to like that. We've covered just about everything, but like I said on the site, there's a little bit of, there's actually, they look like, I haven't even clicked on these, more info videos, or, there they are. Okay. They're actually little briefs on each different area of interest.
Right, so really people can learn a little something on the website and decide if that's the issue they want help with or not. So we try to give as much education as we can on my website, so it makes it convenient for the patient.
I'll just mention these again, and correct me if I'm wrong. Is it fibroids?
Yes, fibroids.
Incontinence.
A lot of people can have problems with urinary incontinence, and there's no reason to suffer, because it can be properly diagnosed and treated. And now we do a pelvic floor therapy in the office that helps a lot of people with prolapse and incontinence make it better without having medicine or surgery. That's a great treatment that's covered by insurance.
And then we mentioned HPV, osteoporosis.
Osteoporosis, I have bone density machine in my Boca office, and that's screening. Once again, that's preventative, because you can get a bone density test, and if you're starting to lose bone mineralization, you want to treat it, as opposed to not knowing about it, ending up with a fracture. People my age can get fractures, and then it can definitely affect your life and your lifestyle and your health.
Especially women with osteoporosis. It runs my mom's side of the family. We've talked about this.
Right, so you want to get that diagnosed and get on medicine. You never want to get to the point where you're going to end up with a fracture.
That's right. We talked about pap smear. Ultrasounds, you do them in office. You actually read with your tech the results right there.
I have a tech I've been working with for 25 years. I have a great ultrasound machine. We do GYN and OB ultrasounds in office. It's more convenient for the patient. We know the results right away, and that's a valuable tool, because you use ultrasound for so many things that if your OB-GYN can't offer you ultrasound in office, that's really a disservice, and it's very inconvenient to have to go to outside facility for an ultrasound when the majority of OB-GYNs, like myself, offer it in office.
Nice. We talked about birth control, premenopause, and menopause. Fertility treatments. We didn't mention much about that. You doing?
I do basic infertility. People shouldn't suffer with infertility. The definitions of infertility is if you're actively trying to get pregnant for 12 months and you can't get pregnant. But a lot of times with younger women, if they've been trying for 6 to 9 months and they can't get pregnant, I encourage them to come in for evaluation. 35% of the time, it could be something with the man's semen, so it's an easy test to send the man for a semen analysis. And majority of the time, it could be a problem with ovulation, but there could be a lot more intricate problems. So I do a basic workup, and if I can't figure it out, I have no hesitation to refer them to a board-certified reproductive endocrinologist, because the worst thing you can do is keep, having failed when somebody's trying to get pregnant. So if I can't do the job, I get them to the right person for the job.
And we started with delivery and pregnancy, so we touched them all. We got about a minute left, and I just wanted to ask you a little bit about your passion. You wore your actual pin today. I don't know if the camera can see that. You are a diehard Indiana Pacers fan.
Well, I'm from Indiana. I grew up playing basketball. I played in grade school, high school. We were city champs when I played freshman year and senior year. I've been watching the Pacers since 1967 when they were born, so I love NBA basketball. And I like the Miami Heat, too. When I don't root for the Pacers, I root for the Heat. But I love the NBA. I love college basketball. And I also love golf. I have, I still play golf, 9 handicap. And my favorite golfer on the PGA Tour, Ken Duke, he's a great guy. The only person that has scoliosis with a Harrington rod in his back, which is very hard to do and play golf with. He's a great guy, class act, and he'll be on the senior tour next year, and I'll be out there at Broken Sound. I'll follow him for his first tournament on the senior tour.
Nice, and we were talking in the green room lastly. You grew up like 8 blocks from Butler University?
Butler University, a great university. I mean, Hinkle Fieldhouse, Tony Hinkle was legendary coach there. They always play hard. As you know, they went to the NCAA final 2 years in a row. They're a small school, but there's so much tradition. It's a great campus and a great. I'm just fortunate I was able to play basketball on their court freshman year and senior year in high school.
And you come from the state of basketball, Indiana, and you went to Indiana U. Undergrad,
Indiana,
right?
A Tulane undergrad. I went down to New Orleans, but Indiana for med school. And in high school, I went to Summer High School Science Institute at Indiana University. It's a great university, great campus. And Indiana's just a great state for education. In my opinion, they have the best dental school and medical school in the entire country.
Nice. Wow. And how long in South Florida now?
I've been down here since 1991.
Wow.
Long time.
That's great. Well, you're always welcome on the program. You're in the lead for the most guest appearances, 4. That's awesome.
Thank you
we've had
very
a lot
much.
of great doctors on this show, and you're one of them. Again, Dr. Alan Patterson, OB-GYN Patterson.com. Check him out there. He has locations in Boca Raton and Coral Springs. We'll be right back on the You and Your Doctor show. Thank you.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to the You and Your Doctor show, living a longer and healthier life. Second half of the program, we're going to do a little bit of a turn here and talk a little bit about radiation oncology. I looked back, not sure I've had a radiation oncologist on the show in the last 2 years, so you're really in for a treat to find out the latest treatments for cancer here in South Florida. So without further ado, I want to welcome Dr. Arthur Iglesias. Dr. Iglesias, thank you for joining the program. How are you doing?
Good evening, David. Thank you for having me this evening.
And you sound great. Thank you. And you're with North Shore Medical Center in Miami, and then also in private practice, and correct me if I'm wrong, I have it right here, Dr. Arthur Iglesias and Jamie Lozano, Florida Oncology Partners, correct?
That's correct.
Okay.
And, we're both based out of North Shore Medical Center.
Okay, which is North Miami. I've been there a few times, 95th Street, right off 95 there, correct?
That's correct. And the hospital has taken great strides to really improve all their facilities here. We've worked along with the CEO, Manny Linares, and the staff here, along with the administration, to bring in a multidisciplinary approach to their oncological services here.
That's great news for South Florida because although our studio's right here in Boca Raton, which is a little bit up 95, about less than an hour, we broadcast down into Miami and all the way up into the Treasure Coast as well. So, and I know that your hospital is one of the few in the region that has a certain type of cancer treatment. But before I go there, I want to ask you a little bit to kind of explain to us a little bit about radiation oncology, because like I said to start the program, I don't think I've had a radiation oncologist, not a very common medical specialty I run across. So tell us a little bit about radiation oncology.
So oncology is a subspecialty, or radiation oncology is a subspecialty of oncology. Back in the days, it first initiated from radiology itself. Back in the days, once X-rays were developed, they found radioisotopes and they used them to treat ailments, not only cancers but other ailments, including even arthritis and other things. They realized with studies and that would cause other problems. So, with knowledge and with technology, we've come a long way. In the last 30 years, we've made great strides, along with studies and along with technology, to treat patients and have better success rates with treating their cancers, and not only that, preventing damage to critical structures. I remember starting in this field, not as a doctor, as a technologist, but back in the days we used to treat big areas where there was squares and rectangles, and we would have to make hand blocks to block out areas of radiation. Nowadays, all those are seen in the leads and these new machines. We have better imaging techniques where we could really prevent dosing to the critical structures around and give the highest doses to the tumors.
And that's important.
Yes.
Because overdosing, and I don't say it in the drug reference, but overdosing can be harmful to different areas of the body. Now, tell us a little bit about ionizing radiation. Did I get that right in my research? Ionizing radiation? Well,
first we have to look at what radiation is, and there's a whole spectrum of it, right? Electromagnetic radiation, there's non-ionizing, which, it involves radio and microwaves. Those aren't very harmful to tissues, even though they're used in many other spectrums. However, then you get into the ionizing radiation spectrum, where even to the lower end is the ultraviolet, and in some instances, ultraviolets are used for some sort of treatments. Then you go into the realm of X-rays and gamma rays. And gamma rays X-rays are produced by electrons being targeted to, or being, they speed them up and they they get shot to a target, and that creates the X-rays. And then you have the difference in the radioisotopes or the gamma rays, which those are active sources. And nowadays those sources they're bombarded with neutrons, and those are what create radioactive sources, okay? When we go back to the X-rays, we have to look at there's X-rays for diagnostic purposes. That's in kilovoltage, and when you look at the therapeutic realm, it's in megavoltage, and that's what we use with our linear accelerators. Our linear accelerators produce very high doses, and what it is, we try to target the DNA in order for those bad cells to stop replication.
I see, and it sounds very complex, but we're lucky to have people like you in a program like North Shore Medical Center involved in cancer treatment. Now, to kind of set the tone for my next question, I wanted to ask you a little bit about radiosurgery, and then I'm going to do a little tease here for everyone that we're going to talk about one of the latest advances in technology treatment right here in South Florida. But first, what is radiosurgery?
So radiosurgery is a form of radiation. Back in the days, we were doing regular fractionation, day-to-day treatments. Nowadays, we have gone back to the old studies and trying to treat very high doses in less fractionation. Now, what we do is we try to, first of all, radiosurgery. It sounds like surgery, but when we use radio, what we consider is that we do it in a non-invasive manner, being that we target a tumor, being a small tumor, very well circumscribed, and that it's in a location that is not damaging to other areas, and we treat those in one fraction. Now, there's what we call radiosurgery, treating in one fraction, or there's stereotactic body radiation therapy, where we can, nowadays, we're doing it more and more, where we treat 1 to 5 fractions, higher dose per day, with a break. We might treat every other day. What occurs is that we could really target those areas. We treat very high doses to the tumor with very tight margins, and the treatment's done in maximum 5 fractions. Now, it all depends who we can treat and who we cannot treat. It depends on the staging of the tumor, and it depends on the location of the tumor. Now, we also here in North Shore, as I was saying earlier, the administration is taking great steps to bring in to make it a better multidisciplinary approach to cancer care. We were also working with oncologists and specialized surgeons, and we also have urologists that work with us, and we give a kind of an overall approach, and we have meetings here once a week, multidisciplinary tumor boards, where we discuss cases and we see what's the best way to manage the patient.
That's fantastic. You're bringing all the smartest people in South Florida together to figure out what's going on with the tumors. I mean, talking about it with your peers has got to be just amazing to be, if I will, in that room, like a fly on the wall in that room. Must be amazing. Now, I want to share with everyone what I've been getting at here the last few minutes of trying to tease this. So, correct me if I'm wrong, but the hospital you work at in Miami, North Shore Medical Center, is the only hospital in Miami to acquire this new advanced technology for cancer treatment called the EDGE system, EDGE, EDGE system. Now, this is a system that, like you said before, radiosurgery, this actually can break up tumors without even breaking the skin?
That's correct. Now, it also depends how close it is to the skin, and we are very cautious with that. We have the latest and greatest in planning computers, where prior to delivering a dose of radiation, the patient gets brought in. We do a planning CAT scan, and of course, depending on the organ system, we use immobilization devices. And with that, after the CAT scan, the imaging goes to our planning computer, where I sit down with a certified dosimetrist who specializes in planning these treatments. We also work together with a medical physicist, where we compute the dosing, the highest doses to the tumors, and as I mentioned before, we pay very close attention to the critical structures. David, what's incredible about these machines nowadays, especially the Edge, we have sub-millimeter accuracy with this machine. We can treat very small tumors with small margins and very high fractionation. And the best thing is that the patient can get off the table and go about their day. That's the best thing.
That's great news. Now, we're here with Dr. Arthur Iglesias. He's a radiation oncologist at North Shore Medical Center in Miami, home of the Edge. And now, I was talking with Dr. Iglesias on the phone today, and he was telling me this. I was telling him I had never heard of the Edge before being anywhere else besides North Shore, and he said I was kind of right. It's one of the only in the region that does cancer surgery without the surgery. This Edge system that they have in the hospital there in Miami at North Shore Medical. .com. Now, one of the questions I wanted to ask you, what types of tumors and where in the body can the Edge be used? What, is this for tumors in the brain, the spine?
David, very good question. There is a multitude of tumors, and as you alluded, yes, we could treat the brain, the spine, the lung. We have an onboard CT imager on this on the linear accelerator on the Edge. We image patients prior to treatment. We also have an optical service monitoring system that also monitors the patient for movement during the treatment. When we're delivering these high doses, what's also important is that the physician is at the bedside or at the computer side, or monitoring the patient along with the physicist and the therapist that delivers the radiation. We make sure that the tumor that was drawn at the time of planning is accurately in position, and confirming with our physicist and our staff. And you don't only have one person; you also have other specialized medical professionals to confirm the accuracy, and we proceed with the treatment. We also we work with local neurosurgeons as well as other specialists in order to deliver these high doses to these tumors. But yes, we treat brain, spine, lungs, also other organs which may have tumors that are very well localized and that we could treat. Sometimes even not so much curative, but in palliative cases, meaning that the patient has already spread, but we can still control to give patients quality of life. That's very important.
Wow, thanks for explaining that. I'm learning a lot here with Dr. Arthur Iglesias and this amazing Edge system that North Shore Medical Center in Miami has. One of the reasons I wanted to have you on is because this show crosses over a huge region of South Florida, and we're available on the iHeartRadio app as well. So you can always look for 1470 AM iHeartRadio app. So we're on globally, and I know people look online when they come down with a a cancer or type of ailment, they always search online. So this is something that if you have a friend, family member who's looking for the latest in cancer treatment, definitely check out northshoremedical.com /edge, and you can get a little bit more information on this amazing cancer treatment without surgery. I wanted to ask you, Dr. Iglesias, does the Edge require any hospital stay after going under that treatment?
It does not. When we use the Edge here, first of all, for intracranial tumors or brain tumors, or even non-malignant tumors in the brain, first of all, we are using a non-invasive procedure where we use a mask which gets in the initial planning phase. It gets fabricated for the patient. That is a personal mask that is used for that patient. They do not require any hospitalization. The mask gets placed. The patient gets scanned to verify the positioning. The patient gets treated and goes home the same day. And what's most important is, besides giving them the latest and greatest of care, we also give them personalized care. So if patients have any concern, they could reach us round the clock with any of their problems or issues.
And I think we have the number on the screen for North Shore Medical Center, but I'm going to give you an even better number right to the Edge team. Dr. Iglesias mentioned his team a lot of times, so it's 305-835-6173, or just call the main hospital line as well, and you'll be forwarded to his team. Now, we mentioned, Dr. Iglesias mentioned that there's no incision. This is a non-invasive alternative to surgery. No hospital stay. But tell me, Dr. Iglesias, how long, I know each case is different, but how long is a normal Edge treatment take?
David, there's also another technique called the cyber knife, which was used a lot in last maybe 10 years. The thing with that procedure, it's beams converging into one tumor, and it's also what they call radiosurgery or stereotactic body therapy. Now, with a machine like the Edge, where we can treat via arcs, rather than maybe a patient taking an hour on the table or 45 minutes, we could do it between 20 minutes, 30 minutes, depending on the amount of angles and the complexity of the plan. And when I mean complexity of a plan is that we have to realize when we're treating tumors in very critical areas, we have to spare organs, so we have to angle the beams. We also, what's incredible with this machine is that it has a table that has 6 degrees of freedom on the couch itself, the table. So it moves in different angles so that we can really target the tumor. And again, as I keep pointing out to, what's important to me is that we spare the organs at risk surrounding the tumor, and that the patient has good quality of life.
Oh, that's so important. And I see here as well, and correct me if I'm wrong, but can the patient actually return to their normal activity after an Edge session?
Yes, they can. Depending on what the location is, we give them some restrictions, but for the most part, they get to return to their activities of daily living, which are very important.
Very important, as you said, definitely. And now we're here with Dr. Arthur Iglesias. He's a radiation oncologist at North Shore Medical Center in Miami, and also has his practice, Florida Oncology Partners, with Dr. Jamie Lozano as well. Dr. Iglesias, both of you bilingual in English and Spanish then?
Both of us bilingual, English and Spanish, and I'm learning a little Creole, Creole French since I've been in this area. It's a multicultural area, and you know, we're here to provide personal care to our patients.
Yeah, I was going to ask you about Creole, because the studio I'm in, there's a couple of studios next door, and it's actually Creole Haitian radio. So, and I noticed when I went to North Shore that there's a large Haitian population near there. So that's great that you're taking the time to learn that language as well. A lot of people tell me that Spanish, a lot of people who speak Creole would understand Spanish very well. I've had some friends who are Haitian who told me that. So kudos to you and your colleague there for learning the language. But I know at North Shore there's a ton of people who work there who speak Creole as well. And you mentioned it early on. This is a team approach, so that's great news. Let me ask you, how does someone get to actually benefit from the edge? Is obviously we don't call for radiation oncology appointments. It's not something we wake up in the morning and think about. Is that something that's referred from another physician or primary care?
It typically is. First of all, you have to be diagnosed with something, right? With a
Correct.
tumor. Typically, and as I said before, Manny Linares, the CEO here, has taken great strides at bringing an oncology team and the surgeons. We all work together. What occurs is usually through your primary care physician, they set the referral to us. But if along with that, now you have our number, so they can always call here with any questions or concerns regarding diagnosis or management, and we could guide them.
Yeah, and also, insurance as well, so they can talk to your team about insurance. Let me give that number out again. It's 305-835-6173. Or if you're online, I know a lot of you are watching us on Facebook Live because I see all the shares. You can check out NorthshoreMedical.com. Take it a step further and do NorthshoreMedical.com/edge, EDGE, and you can get all the info there as well. Dr. Iglesias, it's hard to believe we ran through so many questions, but you've been so gracious with your time. Thank you for coming on the program and teaching us about radiation oncology and the edge.
Thank you, David. I really enjoyed this evening, and hopefully we could do it again.
Yeah, you're always welcome. That was fascinating. And good night, South Florida, and you and your doctor living a longer and healthier life.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions